Good afternoon. Thank you for making time today to be part of this conversation. We have an absolutely amazing panel with some of Ohio's best and brightest. You probably already know that. That's why you're here. I am Amanda Woodrum, Senior Researcher with Policy Matters Ohio. Our mission is to create a more prosperous, equitable, sustainable, and inclusive Ohio. I was given the absolute honor of introducing our panelists and leading us through today's conversation. We will be discussing the American Rescue Plan and ultimately why it matters to you. This is our third episode in a 5-part series about how federal policy can make a positive difference in our communities and in our lives. Today, we are focused on how we can use these funds to overcome Ohio's health divide, the divide between rich and poor Ohioans, Black and white, and help knock down some of the biggest barriers to health that are creating that divide. As you may likely already know by now, Ohio ranks low among states in the health of our residents. Our low ranking is driven in large part by the difference in health of our low and moderate income residents compared to our more wealthy Ohioans, as well as the difference between Black Ohioans compared to white. And the bottom line, poverty is bad for your health. Racism is a public health crisis. Bad public policy played a role in getting us where we are, and better decisions can and should be made going forward to help improve the health of all of our residents, whether they are rich or poor, Black or white. COVID-19 has taken a disproportionate toll on low-income Ohioans, particularly on our Black and brown residents. Let me be clear here. What COVID did was expose existing flaws in both our economic and healthcare systems. Many of our Black and brown Ohioans and low-income Ohioans have underlying conditions associated with toxic stress from systemic poverty, daily experiences with racism, and living in areas of concentrated poverty. This is what made these residents more vulnerable to the most severe consequences of COVID. The $1.9 trillion American Rescue Plan provides a historic opportunity to right some of our past wrongs and to invest in a just recovery that takes care of all Ohioans, regardless of race, belief, or zip code. And we'll hear from one of our panelists how, in fact, this is exactly what these dollars are designed to do. We all want to live in a community where we take care of each other, neighbor to neighbor. To do that, we need public leaders willing to work for an aggressive public health response. The American Rescue Plan provides us with a pathway forward. Our state and cities have received abundant resources that can be used as a down payment for addressing the systemic barriers to health created by poverty and racism. Let's make sure, by working together, that our elected leaders use these dollars as they were intended, and that they exercise the political will to do what is right to take care of all of us. That is what we will discuss today, and we'll outline a few ways that you can help. Our experts are in budget policy, public health, water infrastructure, and transportation. They include Charlita B. Tavares, Chief Executive Officer at Primary One Health. She's also a former state senator from Ohio's 15th District. And she also chaired the subcommittee on healthcare for the state of Ohio's Minority Health Strike Force. We also have here today my favorite tag team from the Ohio Public Health Association, the co-chairs of the Ohio Public Health Association's Health and Equity in All Policies Committee, Carla Hicks and Robert Jennings. Next, we'll hear from the powerhouse, Crystal M.C. Davis, Vice President of Policy and Strategic Engagement at Alliance for the Great Lakes. Then my longtime partner in crime on transportation issues, Akshay Singh, he's the National Transit Justice Organizer at the Alliance for a Just Society. And we will also hear from my colleague, the Master of Numbers and Pie Charts, Wendy Patton, Senior Project Director at Policy Matters Ohio. You may be joining us on Facebook, YouTube, or Twitter at Policy Matters Ohio. Whatever platform you're joining us from, please like our page, follow us, or subscribe to our channel so we can enlist you in the army of progressive advocates we are building across the state. We will never have the kind of money conservative power brokers have. Our power is in our collective numbers. So please join the ranks of those dedicated to building a more prosperous, equitable, sustainable, and inclusive Ohio. Okay, that's enough from me. Let's get started. Wendy, let's go right to you. Well, let me just say, probably most of the folks here, I've heard something about the American Rescue Plan, and that ultimately there are oodles of money coming into the state from it. Can you tell us why the American Rescue Plan matters? Maybe put a little bit more on the meat on the bones of what oodles actually means in this context, and give us a better feel for what the money can be used for.
Thanks, Amanda, and thanks for having me on today. Thanks to everyone out there who are participating in and listening to this live stream. The key active ingredient in the title of the American Rescue Plan is the word rescue. These are rescue dollars. We have to keep in mind that the pandemic is not over. Children are not yet vaccinated. Hundreds of new cases of COVID are reported daily in Ohio. People are still dying of it. The labor market remains millions of jobs short of where it was before the pandemic and recession. This Rescue Act is really all about rescue and recovery. It's about health, the social determinants of health, pandemic mitigation, prevention, ongoing testing and tracing and vaccination. It's also about rebuilding in a way that offers rescue to those people harmed the most in the pandemic and the recession. Importantly, Black, Brown, and Indigenous peoples, people of low income, communities of color that bore the brunt of both providing ongoing services while many sheltered in place, the essential workers, and their communities. Today, we're primarily talking about the funds that come straight to the state and to local governments and have an element of flexibility in them. The state will get $5.4 billion over the next 3.5 years. The funds have to be dedicated by the end of December 2024 and fully spent by 2026. Local governments in cities over 50,000 will get $5.3 billion within the same time frame. And there are other American Rescue Act funds coming into the state. For example, some go directly to schools, some go directly to transit authorities, and Akshay will tell us about those. But many of us are talking about use of this relatively flexible rescue funds in state and local government aid. These funds are relatively flexible, but they are targeted to rescue and recovery. Health and public health is the first area mentioned in the interim final rule from the Department of Treasury. There's an emphasis on providing services for mental and behavioral health and for addiction recovery. Opioid deaths have risen during the last hard year. 40% of American adults report being depressed and anxious. It was 11% before the recession. So there's just a lot of work to be done on health and mental health. The funds are specifically mentioned in the interim regulations to be spent to help people in communities who were economically damaged in the recession. This can be with rental and mortgage assistance. It may be with job training. It is encouraged that communities and that the state use money to offer grants and pay to essential workers and their employers to help them, recompense them for the sacrifice they made in the last year staying on the job when many of us could shelter at home. Monies can be used for early education to give young kids a head start, for student tutoring and wraparound in qualified census tracts in disadvantaged communities. Qualified census tracts are areas where poverty is greater than 25%. The monies can also be used for planning and implementation of correcting and building better social determinants of health, better housing, better educational opportunities, better healthcare, more providers within communities of color, within low-income communities. Planning and implementation with participation by the residents. There is money for specific types of infrastructure that have to do with health and with opportunity and education. Many of our students were unable to study in this last year because they lacked access to wireless. Broadband is a permissible use of these funds. So is clean water and drinking water in accordance with EPA rules. There's a specific mention of mitigating lead poisoning, yet another epidemic in Ohio, through replacement of lead service lines. So the American Rescue Act funds are carefully targeted. I am hearing from communities that are looking at sort of more standard ways of using revenue funds, more like the last set of stimulus dollars. They're looking for shovel-ready projects. They're thinking of fixing roads and bridges and downtown beautification. That's not what the rescue plan is about. The American Jobs Act, the infrastructure plan, will have funds for that kind of thing. This is really about something different. It's about rescue of people and communities and local economies. So it's a tough, targeted job. There is extensive reporting. The state and larger cities have to have public-facing websites, and plans must be laid with public input. So it's an exciting but different kind of federal aid than we've seen before. So back to you, Amanda.
Sorry about that. Quick question to you to follow up. Would you say that one of the main targets of these funds is to address the social determinants of health?
Yeah, Amanda, I agree entirely, because that is broad and flexible. Almost every element of the interim regulations are addressing the social determinants of health. When I first read through the interim rules, I thought, these rules are describing almost all of the aspects of the Ohio's Minority Health Strike Force Blueprint, which has already given us a blueprint for improving the social determinants of health in many communities. And that's exactly the kind of expenditure that this money is targeted to.
Great, thank you. And that's a good segue, I think, to Robert and Carla. Bad policies have actually gotten us to where we are, this health divide. How do we make better decisions going forward, starting with how we allocate these dollars from the American Rescue Plan? Carla, do you want to kick us off?
Sure. Thank you, Amanda. I want to set a little additional more context as to why a health and equity in all policies approach is so important to have within this discussion and when we're looking at allocation of these funds. As you've shared, the poor outcomes, hospitalizations, and deaths that were experienced by minorities, racial ethnic minorities, simply thrust into the broader public view health disparities, the health disparities that we've known have existed for decades and decades. Excuse me. And if we drill even deeper and look at those risk factors that were present in terms of those poor health outcomes with COVID-19, diabetes, hypertension, heart disease, we can better understand some of the whys. These present in Black and Brown communities with greater percentages. And these risk factors are often created, they're often exacerbated in an environment of limited or lacking resources, and specifically looking at the social determinants of health. Again, quality education, quality housing, income, transportation. Opportunities in these areas are significantly rooted in past and present public policy. So I mean, that clearly, I think, speaks to why when you're talking about this plan, when you're talking about these funds, a health and equity in all policies approach should be part of that discussion. In looking at what health and equity in all policies, or you often hear it called HEIAP, what it is, it's a change in process for decision making. It also provides opportunity for institutionalized change, specifically looking at proposed bills, looking at proposed rules through a health and equity lens. And this would be operationalized in Ohio through the Legislative Services Commission, or the LSC. And specifically what they would be doing is taking each of the proposed bills, the proposed rules, and doing an analysis or a review on those bills and rules to determine if they will have potentially a positive impact, a negative impact, or a neutral impact on the health and equity for all Ohioans, as well as for special population groups. And then in turn, this analysis and the determination, very importantly, the determination will be attached to all proposed bills and rules as they go through the legislative process, so that decision makers, so that legislators can make an informed and transparent decision in terms of the impact of that bill or that rule on the health and equity for Ohioans. There are also several other components to a health and equity in all policies approach, and Robert Jennings will be going over those components.
Thank you, Carla. And I think it continues to be said, and rightfully so, but I'm going to say it again. We hear over and over again that COVID-19 exposed existing flaws in our economic and healthcare systems by the disproportionate toll it took on Black, Brown, and low-income communities. But those flaws have been hiding in plain sight, and those of you who have been working in this health equity space have been sounding the alarm for decades about these inequities, and that the larger public is just now starting to wake up to these issues, as well as the lawmakers who draft and support and approve the rules and laws of our society. The Ohio Public Health Association, as Carla mentioned, has been working with lawmakers like former state senator Charlita Tavares and now State Representative Erica Crawley to support an upstream or a legislative intervention to these health and equity issues. So just imagine if we, instead of just making laws randomly, that we really look upstream and included health assessments in the laws and rules that we developed for our society. To me, it only makes sense. We should be doing this already. We're doing it in some small ways and small places, but what OPHA and others around the state, especially Policy Matters Ohio, is that we're looking at making health assessments part of our decision-making process. So the initiative that we are looking at and that has gained some traction, but now we're asking all of you who have joined us today to join in on this effort, is this initiative would require, as Carla mentioned, at the beginning of a draft piece of legislation, that the Legislative Service Commission would have to look at a health impact assessment as part of its decision-making process. They already look at laws, draft laws through for economic, fiscal and environmental impact. So all we're saying is, why don't we do a health assessment? And our initiative proposes that one more step. And so that would be the beginning. Have LSC draft a health assessment, and the legislators do not have to drop the law based on what the health assessment points out. They can still go forward with the bill or the law, but it would be another tool. It would be a data point that they could look at and say, okay, we hadn't considered the health impact of this particular law or rule. The second component of this initiative would be conducted through the Joint Committee on Agency Rule Review. And the Joint Committee on Agency Rule Review basically looks at rules to ensure that the rule of these basically 100 agencies that own these rules, that these rules aren't going over their authority. And so they don't, you hear that JCAR doesn't approve rules, but they just make sure that they fit within the construct of the authority of those agencies that are overseeing these rules. So we asked for just another step where there would be a legislative, a government a look at the rules and laws and policies that we put in place. So that's where JCAR would go in. We'd have LSC, we'd have JCAR, LSC looking at draft legislation, JCAR looking at rules, and then a third component, which would kind of make sure that all of us as organizations, folks that are working in organizations and folks that are dealing with these health equity issues all the time, folks in transportation, education, the social justice system, we would form an advisory board, a health and equity in all policies advisory board made up of all these different groups. And it's important that they're not just part of the healthcare systems that we are in this transportation space, this education space, the social justice space, and have these folks on this advisory board that annually would review these health impact assessments done by LSC, done by JCAR, and that they would provide a report back to the General Assembly to let them know how well these assessments have been either used, what they've uncovered, or ways in which they can be done better. And again, just another layer of oversight. And then there'd be the full transparency of making that annual report to the General Assembly public. So the general public would then be able to see, okay, government is working for us and they are considering health considerations. And then the fourth component would be the creation of an interagency team. You know, we have all these state agencies that are doing great things in our communities, but they're not talking to each other in ways that impact health. So what we're suggesting through an interagency team is that there be a representative at each state agency that would help coordinate across agencies the efforts that they are doing and the work that they're doing, and kind of see where they intersect with our health. And then they would report to, say, the Department of Health, or the Department of Health would kind of oversee that agency, that interagency's team's work. So there's four components to this piece of to this initiative. And we would like some dedicated effort put toward this, and we think the American Rescue Plan can offer that. Let's not waste this opportunity. We don't need to use these funds for, as Wendy pointed out, for building bridges and roads. The infrastructure bill will take care of all of this. This is something to build our people, to build the health of our societies. And if we want to live in a society where everyone enjoys their optimal level of health, then let's come together and do something about it. And it can begin with the American Rescue Plan, and we can build back better. So thank you. Amanda?
Thank you. And before we flip to Senator Tavares, I'm going to ask you what lawyers would call a leading question. Shouldn't we be thinking, given the goals of the American Rescue Plan that Wendy outlined, shouldn't we actually be using health and equity impact assessments on these dollars before we allocate them to make sure we're we're making decisions, informed decisions that lead to actually accomplishing the goals of the American Rescue Plan?
We defer to Carla.
Absolutely. Oh, yeah, that was a great lead in. Thank you, Amanda. Absolutely. Because that's the beauty of a health and equity in our policies approach. It can be used in organizations. It's a planning and implementation tool. And I mean, there's nothing greater than our health. And everyone should have equitable opportunity to have good health, outcomes. So it should be in every planning step for all that we do in terms of funds going to the welfare of Ohioans.
All right, thank you. Let's now move to the amazing Senator Tavares. You've actually already done some really important work thinking through Ohio's health divide and, frankly, how to tackle it. In response to the disproportionate toll COVID has taken on Black communities and other communities of color, Governor DeWine created the Minority Health Strike Force, and you were put in charge of the healthcare subcommittee. Can you tell us more about how and why the strike force came about, some of what you heard during these meetings, and key takeaways from the blueprint that the strike force came up with? Is this potentially a guide to how we distribute American Rescue Plan dollars?
Thank you very much, Amanda, and thank you to Policy Matters Ohio for conducting this seminar, this instructive discussion about how we use the American Rescue Plan Act funds. Absolutely, this is a point in time where we can use these one-time dollars, and I think we've got to keep reinforcing that these are one-time dollars to make an impact on rescuing our people in communities across the United States. The governor's Minority Health Strike Force came about because of the inequities in testing of people of color and other vulnerable communities, whether they were Appalachian, whether they were individuals who were developmentally disabled throughout the state of Ohio. What we saw, the people that were being tested were not people of color, those with developmental disabilities, and our Appalachian community members. And so the strike force came about because what we saw is disproportionate deaths, disproportionate hospitalizations, and lack of testing within these communities. And so the strike force was developed with more than 40 individuals throughout the state of Ohio, with 4 subcommittees to address different aspects of what was going on in the healthcare environment, specifically to address COVID-19, but more broadly to take a look at what is happening with inequities and underserved people within the state of Ohio. And so one of the principles of the Minority Health Strike Force, and certainly the committee that I chaired, the healthcare subcommittee, was to dismantle racism to advance health equity. And I really want to give a strong applaud to the Health Policy Institute of Ohio, who helped put together not only the final blueprint, but the interim report. They really took all of the information that those of us who sat on the Minority Health Strike Force, they really took all of the recommendations, all of the discussion, and put it in a solid blueprint. I do want to say more than 40 people served on the task force. However, we each went out and gathered additional information from experts from throughout the state. We also called through reports that have been conducted before, whether we're talking about the Ohio Black and Minority Health Task Force way back in the mid 80s, whether we're talking about the National Medical Association's plan on how to address disproportionate, inequitable health care in the United States, or other reports, we took those and pulled out those recommendations that lined up with what we were seeing with COVID-19. And some of those I want to share with the audience, because if we're going to dismantle racism to advance health equity, now is the time to do it. If we want Ohioans to have better lives, rescue those who need it most. And so one of the recommendations was, first and foremost, to acknowledge racism as a public health crisis and commit to swift action to dismantle racism, which is a driving force of the social determinants of health. So that's overall. Then, getting back to the discussion we just had with Carla and with Robert, this one of the recommendations, the second recommendation, was to apply a health equity lens to policy. Again, reinforcing what we heard from Carla and Robert. And then the next recommendation that I think is really important: ensure equitable representation of Ohioans of color in government and private sector leadership. I want to highlight that. I am the CEO of a federally qualified health center. It's really important because we get designated by the federal government. One of the requirements is that 51% of our board members must be the people that we serve. So 51% of the policymakers, those that approve the budget, those that decide where services are going to be provided, how services are going to be provided, when services are going to be provided, are the very patients that we serve. I propose that all private and public sector entities take that same kind of requirement and ensure that their boards, their leadership reflects the populations that they say they serve. If you serve the public of Ohio, then take a look at the public of Ohio and look at your leadership structure. Do you have people throughout your organization at all levels of the organization, from the very top to the frontline workers, that reflect the populations that you serve? The fourth recommendation was to develop community understanding of health literacy and to build trust amongst the populations, again, that you say you want to serve. And then the fifth one, require cross-sector cultural and linguistic competency and implicit bias trainings. Again, we have a point in time now to do just that, so that we can start building a foundation amongst all of our health, human services, and people-touching organizations, including law enforcement. And then the sixth recommendation was to develop cultural competency and language access plans. So you go beyond just the trainings. You have a plan that looks at your policies, that looks at your staffing, that looks at your promotions, your HR policies, to ensure that you're ensuring that every staff member within your organization has the opportunity to advance, to move up the ladder, and that you're not disproportionately and negatively impacting individuals, because that gets to poverty. Why are certain populations staying in these categories of work, which are lower paid positions, whether we're talking about the private sector or the public sector? And why are other individuals moving up, advancing, growing wealth? And then the seventh one that I'd like to talk about is to develop a plan for future emergency response efforts. Okay, we have COVID-19 right now. We're not out of the pandemic, but we can learn a lot from what happened with COVID-19, how we responded. We now have the ability to map, to show where the disproportionate testing took place, disproportionate vaccine is still taking place. We can do that for other kinds of health conditions, other kinds of communicable diseases and pandemics that may come in the future. We have those tools, let's use them.
That's brilliant. I am particularly excited about the idea that um, every entity should reflect the diversity in the community that it serves. Is there? I mean, that's true, of course, with the police force, but also our grocery stores, our healthcare system, hospitals, libraries. And I wonder how we get from where we are to where we need to go. And should we sort of predicate some of these American Rescue Plan dollars on sort of as an incentive to help us get there? Any thoughts on that?
Well, I think it could be used as incentives to encourage people, but it is the right thing to do. And if you really say you want to build trust, build support of your organization or your entity within the communities that you are in, the best way to do it is to reflect the communities that you're in. I mean, it goes a long way to be in the middle of an African-American community and have no staff within that organization, whether it's a grocery store or whether it's a gas station, whatever the entity is, and that nobody in that organization comes out of that community, looks like the members of that community. And whether you're talking about African Americans, Asian and Pacific Islanders, Latinx, Native or Indigenous people, you want to make sure that you are reflecting your population of that geographic area. And I don't think it really takes incentives. I think it takes leadership and commitment. You can't just say you're about diversity, equity, and inclusion, because those are words. And many companies, many organizations are creating these DEI positions, diversity, equity, and inclusion, but that's as far as it gets. It's a position, one person, generally with no portfolio, no funding, no staffing, and with no real plan to move the organization to be diverse, equitable, and inclusive.
Great. Thank you so much. Let's switch gears a little bit and go to Crystal. We heard from Wendy that the American Rescue Plan actually specifically identifies mitigation of lead poisoning and the replacement of lead pipes as a proper use of these funds. Can you tell us about why this is important and what's the need in Ohio?
Sure. I also want to just take a moment to make a little note for myself that I never want to go after Senator Tavares ever again. It's not fair, and I'm not going to let that happen again. Okay. She just preached a whole word for y'all.
I know. Right? We can just shut down the shop right there.
But thanks for the opportunity to join today. Just a little bit about the Alliance for the Great Lakes. So there's some context for how we got to this work, because I think that matters. The Alliance for the Great Lakes is a regional nonprofit that is 51 years old, based in Chicago with 5 offices throughout the Great Lakes states. And so we focus on a myriad of water issues. And I have the pleasure of serving as Vice President of Policy and Strategic Engagement from our Ohio office based in Cleveland. And I manage our policy portfolio on agriculture and water issues and drinking water issues. And so the lead service line replacement work, water affordability, and water infrastructure work is our newest water policy priority. And that came as an outgrowth of our community conversations with Cleveland and Lorain communities. And so when I started in this job in 2016, I had community conversations, and what we heard was water affordability is something that deserves your immediate attention. That is something that is my connection to the Great Lakes. And so we have to meet people where they are. When you talk about how to engage folks, that's how you engage them. For some folks, their connection to the Great Lakes is that it's their source of recreation. For others, it's their source of tap. And so that's how we got to this work. In terms of the water infrastructure needs, we know that in Ohio, over the next 20 years, our wastewater and drinking water needs in Ohio will reach about $28 billion. That's substantial. Because going to the State House where folks are faced with term limits and you're saying, hey, I need $28 billion over the next 20 years is a huge price tag and doesn't really yield the political will to do anything, because anything that they do is going to be a drop in the bucket. It sounds like monopoly money. And then over the region, the need equals $188 billion over the next 20 years. And so that is substantial. We know that today we're talking about the American Rescue Plan. We know that there's substantial money coming to Ohio. A number of groups from various sectors have come together to say, we think this is a major issue. And I stress various sectors because there are health groups that understand the health implications of lead. There is no safe level of lead in the body. Environmental groups that understand that, economic groups, business groups that understand that have come together to say, listen, of all the money that Ohio is getting, can we set aside $1 billion for lead service line replacement? Because the need in Ohio, the fact is, Ohio has the second highest number of lead service lines in the country after Illinois. We have 650,000 lead service lines in Ohio. That's unacceptable. And so I know we're talking about the American Rescue Plan, but even with the jobs plan, they're talking about major water infrastructure commitments to the tune of $111 billion nationally. And so I'm not a math major, but if the Great Lakes region's need is $188 billion, and nationally we're poised to get $111 billion, it just doesn't add up. And so the drinking water, the American Society of Civil Engineers gave our nation's drinking water system a C-. And I don't know about your household, but the only C that was acceptable on my report card was the C in my name. And so a C- again is unacceptable. This is something that has huge implications on our health, our safety, our babies. Again, to comments that were said earlier, social, racial, and economic justice are inseparable from environmental justice. And so all of these are tied together. A little bit about what the potential challenges and opportunities are. And so what we're hearing at the community level are, because that's important, what we're hearing at the community level is that we're excited about this money. Make no bones about it. We are excited that we're finally getting some attention to these issues and that water infrastructure is a national conversation. But there may be lack of local capacity to handle the funds that are coming down. Have we thought about the fact that some of these local agencies may not have the staff and the infrastructure in place to really administer the funds? And then is that going to put a disproportionate burden on our community groups and community organizations who are going to be tasked with doing the outreach and the engagement to get folks to sign up for these programs anyway? Because let's keep it real about the fact that these community groups are the real messengers in the community. They're the real folks who really know how to go to Miss Jackson's house and get her to sign up, because she will only listen to those neighborhood navigators. So are we putting more pressure on these neighborhood navigators, and how are we going to compensate them for that? Another potential challenge is single movements. Again, are we talking about environmental justice separate from justice, separate from economic justice? Or are we addressing these things holistically as we should? Again, to Senator Tavares's point, lack of long-term funding. We're appreciative, but are we talking about how we can leverage this one-time funding appropriately so that it's sustainable? How can we stretch this dollar? How can we leverage this? What financial mechanisms can we put in place to really make this work to our advantage? And then I think arguably, most importantly to me, integration of community. And I always, always, always quote Kim Foreman of Environmental Health Watch. That does not mean bringing community in after it's all said and done, like, hey, how was that? Did you like it? Was it good? That is not community voice. That is not authentic community engagement. It goes from ideation stage to implementation, holistically bringing community in and partnering with community so that it's a collaboration all the way through, so that we are making sure that they are at the table. And as another mentor said, forget this idea, or let's dispel this notion of getting more folks to the table. Let's break the table because it was never created for half of us anyway, right? It wasn't even created for me. So let's just break the table and create a whole new table that was really create one for all of us. And then let's get everybody at that new table so that we can create policy that engages us, all of us, equitably. And so that equity is more than the buzzword that it's being created to be. Thanks so much for the opportunity.
Yeah, I mean, that makes a lot of sense to me. Maybe we need to break the table because it seems like clean drinking water is a basic prerequisite to civilized society. And how can we be the richest nation in the world and not have clean drinking water for everyone? To your question about local capacity, do you see these ARP dollars, the American Rescue Plan dollars, as maybe a way to lay the groundwork for what might be much larger American Jobs Plan dollars?
Absolutely. I think it's a huge opportunity. And as I think you said before, or maybe it was Wendy, that this is a down payment. And this is a pilot project and an opportunity to kind of talk a little bit further about what we can possibly do in the future. I think it could be. It really determines how we do that, how we structure that. And so it's upon us to make sure that we are equitably engaging folks and making it what it needs to be.
Yeah, and starting with how we allocate these dollars, I think.
Yes, and how we allocate them, and how it's dispersed at the local level, and all of everything in between. So,
yep. I hear you. All right, Akshay. One of the biggest barriers to economic stability and good health that unfortunately often goes under the radar is access to transportation. It's how we get to where we need to go when we need to get there, whether it's jobs, economic opportunity, training, the doctor's office, the grocery store. We heard from Wendy that the American Rescue Plan actually included some direct funding for transit, which is great. Can you tell us why this matters? Is it helpful? Is it enough? Do we need more?
Yeah, I'm gonna hope my internet holds out, so just bear with me. I can hear my fan on my computer chug-a-lugging. But I just want to say thank you, Senator Taveras. Everything you said, it directly applies to the area of transportation. Speaks to why you were a champ for public transportation when you were in the State House. And so thank you for that. Crystal, I believe you held your own as great as those remarks were. And so everything you said about needing to engage in community is vitally important as well. So I just want to echo those to begin. So yeah, just overall, we've seen in Ohio, this is no new phenomenon. Transit agencies have been underfunded for nearly 2 decades. In 2014, the state of Ohio recognized this itself. The Department of Transportation was able to identify that we need at least $150 million of state investment into transit per year. And so we also know that it doesn't always arrive because riders are typically disproportionately people with disabilities or medical conditions that preclude driving, workers of color, students, immigrants, refugees, people of low income, folks who have often been left behind in public policy in the last couple of decades in Ohio. So needless to say, that state aid hadn't surfaced. Ohio and nationwide transit agencies have been facing just being wiped out over the pandemic. So first of all, what we saw in the CARES Act and the American Rescue Plan was absolutely represented a savior of public transit to keep these agencies going and above water. So what that also meant was unprecedented federal access to paying for operating expenses. So in the CARES Act, transit agencies got about $25 billion between urban programs, rural programs, tribal transportation programs for folks in Native communities. And then in the American Rescue Plan, that was about $30 billion. So, what we've seen is still not only with that money, but over the pandemic, who are essential workers and in-person workers, and that they're still using transit very oftentimes on many routes and commutes that have remained vital for their own income and livelihood, which we know is people's passport to getting healthcare access, because health insurance is often tied to jobs. And so as well as healthcare workers themselves who were still going in person, absolutely, and still needed their routes. And so in Ohio, we did see some of these best practices by transit agencies of taking this federal money and putting it to use for the workers and riders of their systems. So we saw bus capacity limits, so buses themselves wouldn't be overcrowded, extra buses that were put into service to make sure that we could meet those capacity limits, as well as get people around fare-free transit to make sure that you could accommodate riders and workers just quickly, don't have them having to do extra interactions with the operators and just jump on the bus, find a safe seat with your mask on and get to work. And so we saw a lot of necessary transit trips, but also ones that represented people taking their own lives in their hands. And that absolutely played for transit workers. Across the country, the Amalgamated Transit Union lost 152 of its members to COVID. In Ohio, that has included mechanic Gary Hahn, Cincinnati ATU Local 2627. This is something that has absolutely been here in Ohio as well. And transit workers over this time never received hazard pay or anything like that. So we saw folks doing essential work, taking their lives into their hands, and still doing their community work for the public. So it's really vital that we continue this investment into our people. So one of the other things that we do know about transit investment is that when we put $1 billion into just service, it yields over 20,000 jobs to support within just transit workers alone, let alone all of the people they support as they're commuting. Care workers, service workers, facility and sanitation workers, all are in person. So as we reopen Ohio, we just want to make sure that we're restoring and expanding transit service on the ground. And agencies have been identifying where those priorities are, and that we expand service, especially to make sure that we're meeting needs as we go forward. So that's a real big priority we're fighting for in Ohio and all this national campaign.
Awesome. We've heard from a couple folks, including yourself, that the American Jobs Plan might be an opportunity to secure a pretty massive amount of infrastructure investments. Is this an opportunity to kind of rethink how we do transportation in this country? Yeah,
so one of the big pieces of building back better is that we take climate action seriously. Transportation right now is the #1 source of greenhouse gases as an emitting sector in the country. And so without being able to fund actual transit service, not just kind of the big projects that are shiny and construction, but also making sure we have the service to run those actual service vehicles and get people around where they need to go on necessary trips, we won't be able to meet the needs of taking climate action. So I think right now we have an unprecedented opportunity to get federal support for transit straight to the communities that they're serving, and really orient the federal funding model to say, hey, your job as a transit agency is actually to move people, not to just build a new streetcar or a new rail lines for development. So it's
really road. right?
Yeah.
We got enough of those already. All right, I am going to pose one final question for all of you, and I think Wendy, if you could get us started. What's next? How do folks engage in the decision-making process, or how we decide either to use the American Rescue Plan dollars or what goes into the American Jobs Plan? Wendy?
Thank you, Amanda. The use of the American Rescue Plan dollars is being decided right now, being discussed at the state level, and in some cities is being acted on by city council. What I hear from cities across the state is an expectation at city councils that this money is like the last federal stimulus round in the recession of 2008. We need shovel-ready programs. This is a whole different ballgame. What we need is programs that can implement planning and implementation that address the social determinants of health and all these different factors we've talked about today. I know folks who are reviewing the ordinances that are being passed in their cities and coming up with their own ordinances and working with their city council members to redirect funds back into the neighborhoods and back into the people who still need rescued. So getting involved with your local city council and your local administration in your city are critical. So is getting involved with your local state elected leader. Right now, those discussions are going on. It would be really great if the American Rescue Plan dollars that go through the state that will be allocated through the controlling board or through legislation, if every element of that were reviewed by a health equity node, as Carla and Robert pointed out, so that we knew exactly, we knew that they were well targeted, that there was citizen input, and that they were addressing both our current and future health crises. So now's the time to get involved. Your local electeds are the folks to get involved with, and also like-minded people, coalitions, and community groups like yourself work together. Amanda?
Yeah, anyone want to add to that? I hear some kudos and right on to what you just said.
I would just reinforce what Wendy said. The county of Franklin and all the counties across the state received dollars from the American Rescue Plan as well. And that's an absolute best way to coordinate not only transportation and environmental issues within our communities, but also health and other social determinants of health that can be addressed with those dollars coming to your county commissioners, coming to your state legislature, coming to cities around the state of Ohio. We've got to stand up as individuals, as community members, as organization leaders to be a part of the planning of how those one-time dollars, and to set up successful plans to rescue the people within our communities.
All right, I'm not going to make anyone go after Senator Tavares this time. I want to thank you all for joining today's live stream. To those in the audience, I would ask you, please join our next installment of the American Rescue Plan next Thursday, where we'll discuss the rescue plan's impact on our state and local governments and how you can advocate for people's budget. And last but not least, be sure to like, follow, and subscribe to our social media accounts. We need you. We need your help to make Ohio healthy. Thank you for watching.